Have you ever felt a bit unsure about how to clearly describe personal health concerns, especially when they involve something as sensitive as bladder issues? It is completely normal to feel that way, but effectively communicating with your healthcare provider is truly the first step towards feeling better. The most effective way to explain your bladder problems to your healthcare provider is to arrive prepared, speak openly and honestly, and provide specific, detailed information about your symptoms and how they impact your daily life. This foundation allows them to understand your unique situation comprehensively. Your healthcare provider relies heavily on the information you provide to accurately diagnose your condition and develop the most suitable treatment plan for you. Without a clear understanding of your experiences, it becomes much more challenging for them to pinpoint the exact issue or suggest the best course of action. They need your insights to connect all the pieces of the puzzle. To prepare for your visit, begin by creating a detailed list of all your symptoms. Think about when your bladder problems first started. Were there any specific events or changes in your life that coincided with their onset? Describe the exact nature of your symptoms. For example, if you experience pain, try to explain what it feels like. Is it a sharp pain, a dull ache, or a burning sensation? Is the pain constant or intermittent? Where exactly do you feel it? Next, it is incredibly helpful to keep a bladder diary for at least 2 to 3 days, or even up to a week before your appointment. In this diary, record everything you drink, including the type of beverage and the amount. Also, note down every time you urinate, including the time of day and an estimate of the volume if possible. Importantly, track any instances of urgency, which is that sudden, strong need to urinate, or frequency, meaning how often you need to go. If you experience any leakage or incontinence, record when it happens, what you were doing at the time, and estimate how much leakage occurred. This objective data is invaluable for your doctor. Remember to also list all medications you are currently taking, including prescription drugs, over-the-counter remedies, and any herbal supplements. Some medications can significantly influence bladder function. Be ready to discuss your medical history, particularly any past bladder infections, surgeries, or other related health conditions. Do not hesitate to mention any concerns about your sexual health if you believe it is related to your bladder symptoms. When describing your symptoms, using precise terms can be very beneficial. For instance, urgency describes a sudden, compelling need to pass urine which is difficult to defer. Frequency refers to urinating more often than usual during the day. Nocturia means waking up at night specifically to urinate. If you experience leakage, explaining whether it happens with a cough, sneeze, or laugh, known as stress incontinence, or if it is associated with a strong sudden urge, which is urge incontinence, provides critical clues. This detailed language helps your provider understand the specific type of bladder dysfunction you might be experiencing. Your bladder diary will truly be an insider tool that helps your doctor see the patterns. By carefully preparing your symptom details, diligently tracking your habits in a bladder diary, and engaging in an open and honest dialogue about how these issues affect your life, you are actively empowering your healthcare provider to help you. This thorough and proactive approach ensures that you receive the most accurate diagnosis and the most appropriate, personalized care, ultimately leading to better symptom management and a significant improvement in your overall quality of life.